last week we started our discussion. We left at a point where we were discussing about cellular injury and the cellular changes that happen, adaptation, the various mechanisms that the various cells utilize in relation to when they have been exposed to any internal or external stimuli. So like we said, some of these changes can be reversible, others are irreversible, and they're normal to some in that they are just for a moment to adapt to the introduction of any external or internal stimuli. But we also have those that are irreversible, which can basically affect the structure of the cell and also can affect the function of the cell. So we looked at some of those cellular changes, the atrophy, the hypertrophy, the hyperplasia, dysplasia, metaplasia. We were able to say what they are and more especially what can potentially cause that. So I want to really talk about that. And later on, we talked about cell death. That is, we talked about necrosis, which we also talked about. Just a minute, I respond to this. Yeah, so like we said, we talked about apoptosis. I said apoptosis, that is now what we refer to as the programmed cell death, where now the cell dies through now activation of the various internally controlled mechanisms. And apoptosis mostly is designed just to remove out those unwanted cells. Some of them, when they have abnormally developed, those cells that have abnormally developed, or when we have cells being produced in excesses, or those cells that have been injured or they have been or they have aged, like the red blood cells you talk about 120 days after that, they are basically programmed to die and eliminated from the body. Then we're talking about necrosis, which is now cell death, that what we can refer to as unprogrammed cell death. Here now the cells get to die as a result from ischemia or chemical injury. So usually necrosis happens as a result of a disease process or as a result of an introduction of an external internal stimuli that suddenly kills the cells. So we have various causes of cell injury, like now for the ischemia, could be as a result of deficiency of oxygen to cells, and deficiency of oxygen can be as a result of respiratory or cardiovascular related diseases. We have physical agents that can also affect or can lead to cell death, thermal heat or excessive cold, which can impair blood supply or can alter the various body metabolic processes, can alter the DNA of a cell, and also can lead to accumulation of toxins within the cells, which can lead now again to cell death. The chemical agents could be from both inside and outside the body. That's exogenous from the environment, the endogenous from inside the body. Infectious agents, the parasites, the fungi, the viruses, can also lead to cell injury. Genetic defects, which now, of course, can cause abnormalities in the cell, metabolic abnormalities in the cell, and thus the cells are not able now to function normal as they should. Nutritional deficits, some of these nutritional related deficiencies like the kwashiorkor that can affect now the body cells and can lead to sudden death of the cells. Fluid and electrolyte balances. When there is an imbalance of the fluids and also the electrolytes, think of it when we have excesses of some of these electrolytes, the excesses of the sodiums, the potassiums, the effects that they have on the cells. And of course, with cell damage, one, there'll be an alteration in the metabolic reactions, the normal functioning of the cells. There'll be loss of function of these cells. The loss of function can either be reversible or irreversible. Of course, I've just mentioned about necrosis and what causes necrosis and the various types of necrosis which we were trying to discuss last week, just as we were put off. So we begin from there, where now we'll talk about homeostasis.